My name is Wendy Ayers. I'm the program director for the Respiratory Therapy program, and today's class is going to be on respiratory therapy and the respiratory therapy program here at Central Virginia Community College. Oh my gosh. Okay, so we have a few people here today. How many of you like riding roller coasters?
Maybe makes me want to throw up.
Oh, so actually the majority of the class likes riding roller coasters. Well, going into the healthcare profession is a lot like riding roller coasters. With roller coasters, things are up and down. You never know what's going to happen. Well, that's sort of like being in healthcare. You can have a day that is, in 1 minute is slow, and then the next minute you are really busy, and you never know when you come into work, you never know what your day is going to be like. You could have a slow day, you could have a really bad day where you don't really have time to even eat lunch. But again, it's like a roller coaster. You never know what you're going to get that day when you come in. So if that is something that interests you, then our program is one of those that can offer you that excitement. Okay, how many of you know how already certified in CPR?
I'll be.
And if you weren't, would you want to be?
Yeah, sure. Yes.
Well, one of the things that I don't know if recently they were talking on the world news about the fact that a lot of people are certified in CPR and how important it is that most Americans should be certified in CPR because of the aging population or any other type of incident you could run into if you were at Walmart or CVS or the mall or wherever you are, you could save a life, right?
Yeah.
Okay. All right, so I have a very brief PowerPoint presentation we're going to do today on respiratory therapy. So what is a respiratory therapist? Well, we are a healthcare professional. What do? We diagnose, we treat, and we educate patients. Where are some of the places that we can work? Well, we can work in hospitals, emergency rooms, clinics, home care, education, private enterprise, research. One thing that's not on there is rehab centers. That is not on there. You can work in a rehab center. So those are just some of the basic information about being a respiratory therapist. So how do we assess and diagnose? We do testing called pulmonary function, where we look at how well your lungs are functioning. It can tell us if you have a restrictive disease, tells us whether you have an obstructive disease. So a lot of people who smoke cigarettes, they will develop what we call chronic obstructive pulmonary disease, and that is an obstructive disease. Pulmonary function testing can tell us about that. Blood gases are another way. This is where we draw blood off of an artery usually in your wrist right here. You have an artery that runs up through here that we will stick for blood gas. And the blood gas will let us know the carbon dioxide levels that are in your blood, the oxygen levels in your blood, and whether your pH is balanced. Sleep studies is another area. A lot of people now are wearing CPAP at nighttime. You may have family members that wear CPAP at nighttime, or you may be someone who wears CPAP at nighttime. And that is a continuous positive airway pressure. What happens with people who have obstructive sleep apnea is when they fall asleep, their airway gets obstructed and their oxygen levels will diminish. And by doing that, your tissue and your organs take a hit. They don't get oxygen, they're going to start working harder. So if you don't treat your obstructive sleep apnea, what you could end up with is heart failure, blood pressure, hypertension, or increased blood pressure, a lot of other things, diabetes. It can make it worse. So really, if you have obstructive sleep apnea, you really need to treat it and use CPAP at nighttime when you sleep. Chest x-rays is another way. We can look at our chest x-ray and see what our lungs, if we have an infiltrate or pneumonia in our lungs. Listening to the lungs, we take a stethoscope and we can listen to all the different lobes of your lungs while you take breaths in. I know when you go to the doctor, your doctor does this to you. So how do we treat? Well, we use a lot of sophisticated devices to assist in breathing. We call those ventilators. And we also use oxygen. So mechanical ventilators is a big part of our job, is managing mechanical ventilations, managing the airway of your patients. We administer inhaled medications, and those are medications to reduce inflammation within the lungs and also to treat bronchoconstriction. So asthmatics, they have bronchoconstriction, so we will use pulmonary dilators for that. And then maintaining an airway, again, that is a huge part of our job, is maintaining the airway. Well, I was a little saying, if you're not breathing, you're not doing much else. What are the demographics? These are the demographics of the patients that we as respiratory therapists treat. We treat, the mean age is around 44 of the patients that we treat. The interesting thing right now is we are in the midst of where the baby boomers are starting to retire. And if you don't know what the baby boomers are, it started, I believe, in 1943, was it 44? 46, okay. It was after World War II that people came back home from the war, they got married and they started having babies, and people had lots of babies. So from 46 to 64, we had a lot of babies born, and they call them the baby boomers. And that age group right now is in the midst of retirement. So they're reaching the retirement age and beyond, which means that we will have a larger influx into our population of patients in the hospitals and the clinics and seeing doctors because of the baby boomers. And then also asthma and COPD are on the rise. Again, it takes about 40 years for us to really see the effects of smoking cigarettes. So that's one of the reasons why it is on the rise. We're looking at, again, that age group of people that used to smoke a lot because it was the in thing to do in the 50s, 60s, and 70s. So we're starting to see that. And then asthma, I think it's probably on the rise. If I had to take a guess about why asthma is on the rise, is a lot of the chemicals that we have, medications that people are taking. But I do think that a lot of the hormones and the chemicals that we are ingesting when we eat foods, and then when you're pregnant, those things that you're eating actually get mixed in with your baby. So I do think that might be one of the reasons why asthma is on the rise. What is our typical day like? We're usually delivering aerosolized medications, assessing our patients, educating our patients and our patients' families, managing our mechanical ventilators and our airways of our patients, maybe perhaps performing CPR in a code if we have a patient with cardiac arrest or respiratory arrest, diagnostic testing, again, diagnosing lung diseases, and then, of course, rounding with our doctors and developing care plans. That's something else that's part of our day. Talk a little bit about COPD. COPD is the 4th leading cause of death in the United States. It usually occurs in patients that are over the age of 40 and with a history of smoking. It can actually, if you can diagnose it early enough, you can treat it. The issue with COPD is it's not reversible. The damage that's done to your lungs is not reversible. What can you do by stopping to smoking and treating it is you can slow down the disease process, but you can't reverse it. So 80 to 90% of COPD patients, it is related to tobacco. So this is what you see with a COPD patient. This is the epitome of what you see with a COPD patient. They're usually malnourished because of the fact that they have a really hard time breathing. They're typically malnourished because it takes too much work for them to eat. So they're usually very emaciated, cachectic, and they have protruding bones. They have a expanded thoracic cage, usually that we call it sort of barrel-chestedness is what we would call it. But this is typically what a COPDer will look like. Then we have a picture, and we also have our lungs up here that are, this one over here, these are pig lungs. They are not human lungs, but they are real lungs. And then we have these over here that are a replication of what a smoker's lungs would look like. And here's another picture of here on the right of what the smoker's lungs would look like. And these are what healthy lungs would look like. They should be nice and pink. And if you can see in this picture too, they are nice and pink. And then she's going to pump them and inflate them. Again, this is a picture with a patient that has emphysema. And all those little black spots in there, this is actually a cross-section during an autopsy. So all those little black spots on there, they are from smoking cigarettes. This is during an autopsy also. This is an open chest. And this is an open chest of a patient who was a smoker. And so if you can see the rib cage where the rib cage has been removed. Part of it has been removed. And what you have left in the chest is these sort of bulbous lungs that are left. And these are the lungs of an emphysema patient. All those little bulbs, we will call them bulbous or blebs. They can actually rupture and can cause what we call pneumothoraxes, which is air in the chest. But anyway, that's an autopsy. Autopsy of lungs. About 51% of smokers have never heard of COPD. How many of you have ever heard of COPD? A few of you? Okay. And most of our younger generation that are smoking, they're not really concerned about it. Most of the younger generation, they don't think that it would affect them. They have that, what we consider with the younger people is that they're invincible. So they're not really concerned with it. We have about 12 million people in the United States with COPD currently. And about 120,000 will die every year, and that's about 1 every 4 minutes. So if you want to find out more about COPD, you can go to www.learnaboutcopd.org if you want to learn more about COPD. This is actually the percentages from 1965 to 1998. And if you notice, since 1965 to 98, coronary heart disease is on the decrease. Stroke is on the decrease. Other cardiovascular disease is on the decrease. And all other causes are pretty much leveled out. But look at COPD. Since 1965, we've actually had a 163% increase in COPD cases. That is a huge number, and that's not good. And then again, this is breast cancer in comparing with lung cancer. And if you notice, breast cancer is pretty much stabilized out. It really has not had any reductions. Well, I had a brief reduction here. It is on the decrease right now, but from the time period that we looked at it, from 93 to 2000, it wasn't until close to 2000 when we started seeing a reduction in breast cancer. But look at lung cancer, on the rise, has been since 1993 when they started looking at this. COPDers, I'd probably say, are one of our biggest customers as a respiratory therapist. It's one of our biggest customers. You don't think so? Asthma. This is the most common chronic disease of childhood. There are about 22 million asthmatics in the United States, and we are having increasing in frequency of asthmatics. The good thing with asthmatics is we can, for the most part, we've got a lot of newer drugs coming on the market and older ones that we're using to treat them and decrease the occurrences of asthmatic attacks. So the main thing is proper management and education with this disease process. And again, this is just looking at some asthma facts. If you look at these bar graphs, the ages of 5 years of age to 14, that is the largest group of asthmatics. And if you also notice, since 1980, we see an increase in just about every area of age in asthma. Again, asthma is another one of the big disease processes that we treat as respiratory therapists. Education is the key, always the key. Why do I have a picture of stuffed animals? Can anybody take a guess?
Because you're a dog person.
Materials.
What about the materials?
What they're made of.
What is that going to do? Yeah, it's a trigger.
Holds
It's a
dust.
trigger. It holds stuff, right? It holds dust and germs, and yeah, this is actually a trigger for asthmatics. Well, I think that might be a real dog in there.
I think
Yeah.
it is.
He's a trigger too, though.
He's a trigger too. He is a trigger. Real dogs are triggers, you're right. And of course, we have our little cigarette that's broken in half. No smoking. What do you think this is?
Mold.
Mold. Does mold affect people with lung disease?
Yes.
Absolutely. Absolutely. It's a huge trigger also. I want to show a brief video. It is a video from the AARC is an organization that is our international organization for our profession. It stands for the American Association for Respiratory Care. And they have a 6-minute video on here that is about the profession of respiratory therapy and all the aspects of our job and what we get to do and how important it is. And it is one of the jobs that they forecast is on the rise right now. Of course you're not going to do anything now.
The simple act of breathing is not something most people think about. But if you're struggling to breathe, it's the only thing you can think about. It's a matter of life and breath. You may not know it, but you need a respiratory therapist. The respiratory therapist is one of the most critical members of any healthcare team. In the 24/7 world of medical care, RTs work closely with doctors to diagnose, treat, manage, and educate patients with asthma, emphysema, and a wide range of other respiratory problems, from premature babies to the elderly, from the ambulance to the emergency room, from the hospital room to the patient's home. Respiratory therapists are there to help you breathe easy.
I just like the fast-paced, the anything can happen kind of environment.
Nothing ever stays the same, so you have to be ready to improvise at a moment's notice. Patients' lives are in your hands many times.
There's always something going on, you're moving all the time, so being a therapist is a very rewarding job.
Lung disease is on the rise, and respiratory care is among the fastest growing specialties in healthcare. That means a rapidly growing need for professional respiratory therapists. And salaries are rising right along with the demand.
You are, what I was told in school, the experts in the cardiopulmonary aspect of patient's care.
There's usually one of the first ones at the bedside to assess the patient. There are eyes, there are ears when it comes to assessing the respiratory status of the patient.
It is extremely important to have very knowledgeable respiratory therapists with strong communication skills that can work as a team, as a member of the team.
Respiratory therapists are needed in just about every facet of the healthcare system, from diagnostics and patient evaluation to treatment and rehabilitation, from physician consultation to patient education, from rapid response emergency care to long-term case management.
So I love respiratory care. You come in every day, you never know what kind of challenge you're going to face with. It's exciting, the adrenaline is pumping.
You learn new things literally every day.
It's exciting because it's a challenge. I mean, every day there's a new ventilator, there's a new practice.
The career of just about every respiratory therapist begins at a hospital. That's where you sharpen your clinical and bedside skills. It's where you treat every kind of patient and every manner of pulmonary disease and trauma. It's where you become proficient in the use of the very latest respiratory tools and equipment. And it's where you earn the respect and trust of physicians and nurses as a valued member of the healthcare team.
As a physician, I think respiratory therapist is critical to medical practice. They work in all areas of the hospital, they work in outpatient settings, and they work in office settings.
Patients in need of respiratory care can be literally anyone of any age. Premature infants who need a ventilator to breathe, young children with asthma, adolescents whose breathing is impaired due to trauma, adults with sleep disorders, and older people with chronic pulmonary disease.
Respiratory therapists are the healthcare practitioners that have the most knowledge, experience, and training in disorders dealing with lungs.
Other healthcare professionals do not have anywhere near the background in breathing that respiratory therapists have.
This is absolutely powerful.
Though most respiratory therapists begin their careers at a hospital, many move on to work in other settings. Doctors' offices and clinics, diagnostic labs, children's hospitals, nursing homes, corporate and industrial settings, even patients' homes.
You get to learn all these new technology that's coming out in the field, as far as with ventilators, and we have BiPAP machines.
You can take care of neonates, little tiny preemies, you can take care of adults and that whole gamut in between.
You can't work for anybody. Hospitals, we have center, nursing home, we have light, so I love the profession. I'm enjoying it.
Respiratory care is a profession that's always been known for its sophisticated machines and diagnostic tools. Much of what respiratory therapists do is closely tied to medical equipment, like aerosol delivery devices, airway clearance devices, sleep therapy equipment, and ventilator systems, just to name a few.
If you have a knack for toys and tinkering, and you have that mechanical inclination, plus you want to really do something to help patients, that this is the field for you.
You know, healthcare is always changing, so you have to keep up. You have to learn.
There's always new equipment coming out, always new and different ways to do something.
What I've always appreciated about every respiratory therapist I've ever have known is that they're so adaptable.
Now we have computer touch screens where we were dialing stuff. So each year, like as technology progresses, so are we progressing.
There's all sorts of different machines out there that you're going to have to learn how to use and to work with. And you're basically there to keep that patient alive and breathing and keep them comfortable.
Hundreds of colleges and universities offer 2-year and 4-year respiratory care programs, which can lead directly to a credential as a respiratory therapist. That credential opens the doors to one of the most exciting specialties in healthcare.
It's amazing and it's a wonderful feeling to see patients get better and go home to walk out as one big happy family.
You're there supporting them, getting their life feel great.
I'm a people person. It's nothing better than to see them smile.
It's incredible. I mean, it's just an incredible feeling to see patients get well out of the hospital and see them improve.
And if you weren't there, they wouldn't have been alive today. And to see them be able to walk out of the hospital, that's where it's great.
Respiratory care is a field that can take you anywhere you want to go. You can get into pediatrics, home care, research, education, management, acute care, long-term care, sleep medicine, disease management, and as a respiratory therapist, you can work just about anywhere.
Any day, you can pick up the phone and have a career at your fingertips and never be without employment.
I love being a respiratory therapist. I wouldn't do anything else in the medical profession. There's always going to be many, many opportunities. There'll be a lot of doors open for you.
It's probably one of the best decisions I ever made.
Want a job you love? Visit the AARC website and explore the career options in respiratory care.
They have quite a few different videos on here if you're interested in watching any other ones, but I did want to at least show you that one. Kind of gave a good overview of what we do as a profession and how important we are to the healthcare team. Any questions?
How long is the program?
The program is 5 semesters. It's 2 years. You would start in August. So if you were to start this August in 2014, you would graduate in the May of 2016. That first year you go year-round. We do go during the summer. We do not get the summer off. But all of your medical programs pretty much go year-round.
When you're done, can you work in any state?
Yes. Your boards, when you graduate, you'll be eligible to sit for your boards. Your boards are national boards, which means that if you pass your boards, it carries to any state in the United States. The only thing you have to do after you pass your boards is you have to, whatever state you're in, you have to apply for licensure to work in that state.
Where do you do your clinicals at?
We do clinicals at the hospitals. We use Central Lynchburg General Hospital. We use UVA Medical Center. We just started using Southside for first-year students to learn about patient assessment and stuff. But critical care, we do Lynchburg General and UVA Medical Center, as well as we send you to the pulmonologist's office. You do pulmonary rehab. Those are just one day, usually 1 or 2 days that you do those. You do a few specialty rotations, but mainly you're in the hospitals.
How many days a week are you in class?
We're in class 2 days a week, and we're in clinical in the hospital or wherever you're at clinic for 2 days a week. So we go Monday through Thursday. We don't have classes on Fridays. Any other questions?
Do we have to be certified in CPR before we come to the program?
No, you don't. The first couple of weeks, in the first 2 to 3 weeks in the program, we get all of the new students certified in CPR as a healthcare professional. So everybody gets certified. And the certifications are good for 2 years, so it will carry you through the entire program and a little bit beyond that program, where you can, wherever you go to work, usually they have CPR classes to get everybody recertified.
What are the prereqs for it?
The prereqs? The main thing is you have to have, the math is going to be the biggie, is probably the big one. If you've taken the placement test, and it will show you what you need. But if not, you have to have units 1, 0 through 5 to get into our program. So if you were to take the placement test and you qualified for units 0, 3, and 4, then you would have to take 1, 2, and 5. So it's really going to be based on what you do on the placement test. If you transfer math in, usually it needs to be at least up through Algebra 1. 0 through 5 takes you through Algebra 1. So you have to either pass your placement test that would place you into Algebra 2, or you have to take whatever units up through 0 through 5 that you would need. Other than that, you need high school biology, high school algebra, and high school English. The rest of the stuff is kind of built into our program. Into our program, you'll take English, and again, it's going to be based on your placement test as to whether you have to do developmental English. But during the program, it's set into our program where you take English 111, and then you have to have a social science and humanities, anatomy and physiology 1 and 2. Those are all built into the program. It's always nicer if you have them out of the way prior to the program, but you don't have to.
So math, you have to have out of the way.
Math has to be done before you can come into the program.
That's the only have to have.
Yeah, that's really the only have to have. Well, in the GPA. Usually what we do is we start taking referrals between January the 2nd through April the 15th. You have to see a counselor in the counseling department and let them know that you're interested. They will send a referral to me, and once I get the referral, I will send out an application. And once I get your application back, in the beginning of April, usually the beginning to the mid of April, we do interviews, we do personal interviews. And then usually the first part of May, I send out acceptance letters. So acceptance into the program is basically going to be based on GPA, your personal interview, and also a background check. We don't require the background checks, but the hospitals do. We can't take any students that have, certain things in their on their background check, and it has nothing to do with us. It has to do with the hospitals.
And what's the GPA requirement?
Right now it's 2.0, but that's getting ready to get changed. We're changing it up to 2.5, and that's going to go into effect in the fall.
How many students do you guys take a year?
Take a max of 20 a year. That's a max.
20?
Yeah. Yeah, we can only take so many patients. Sort of like your radiology program, your nursing programs, we can only take so many patients.
How many have you had who entered the program in the last few years? On average, are you getting 20?
Are we getting the applicants? Yes. Are we accepting 20? We have not always accepted 20, no.
So everybody that applies does not get it, even if you do have the spaces?
Not necessarily, no. No. I don't think, we really have not turned that many people away. As far as getting into the program. Usually if you meet the requirements, that really has not been an issue. We have had some people that, yes, we have not, but it's because they didn't meet the requirements. So we do try to take most of them that apply.
Do you have a waiting period before you can reapply?
No, you can reapply for the next year. We only accept students once a year, and that's in, they start in each August. We have a new class that starts every August. Have you sent a referral down? No? Did you plan on it?
I have to work on my math.
Okay. You can still send a referral down if you plan on doing your math and getting it done before August. It just has to be done before you can start the program. So you can still apply and interview and get accepted, but if you don't get your math out of the way before next August or August of 2014, then you couldn't start the program. So that's pretty much how we would look at it. Because I've had students that have in the past who have applied, but they didn't have their math out of the way, but they got it out of the way before the program started. She's one of them. Yeah. Any other questions? If you have any questions, these are all my students.